Scarring is a very important concern for patients, and understandably so. And this is one of the reasons why we develop hidden ways of getting to the tissues we need to get to perform a facelift. So general principles are we try to hide scars in natural creases and shadows in the face. So where do we find these? We use the ear. And I do not go in front of the ear except in some men who have a beard line that comes very close to the ear. Generally in women, we go in the natural crease in front of the ear. We go behind this little cartilage called the tragus, so there's not a telltale line in the front, it's actually hidden inside the ear. We kind of carry it back behind the ear in the natural crease of the ear, and I generally don't make a big back cut, which is very visible in a lot of facelift patients. So with this approach on the ears, once that heals up, very quickly, and in fact within a few weeks, most people can't tell there was any incision made at all. There is an incision underneath the chin. Everybody has a natural crease here. You can put your chin down and pull your neck forward and you see that crease, unfortunately, very easily. I utilize that. I put my incision probably about 2 inches, not too big. And with that small 2-inch incision, I can do all of my liposuction, I can do all of my muscle tightening that I need to do to rejuvenate the chin area. And again, it's underneath the chin. So our joke is, you know, only your dog or your cat can see it. So it's something that's well hidden, heals well, and disappears very quickly. There's of course some things that patients can do to make everything heal better, because a lot of the way the scar looks is going to be based on healing. So first and foremost, keep the incision moist. We don't need antibiotic ointment per se, you just need Vaseline or Aquaphor. The goal is we don't want the incision to dry out. Moist wounds heal the best. Nothing fancy, nothing special, just keep it moist. Keep it out of the sun. I'm here in Atlanta, and certainly there's sun everywhere, of course, but if you expose a healing incision to sun, you can have discoloration issues and scars that look a little more prominent than scars that are protected from the sun. Patients will always ask me, well, what skincare products should I use? What special cream? What special gel? And I generally find that they may have a role maybe later on, but these two things that I mentioned are things that the patients can do. Specifically, keep the incision moist and keep it out of the sun. You've won probably 90+% of the battle. There are some specialized dressings that help keep moisture in the wound, and certainly those are available as well. They achieve the same goal as Aquaphor or Vaseline. Sunblock, of course, helps keep more sun out. So these are all things that we can do later on down the line. Antibiotics are not necessary, and actually in many ways antibiotics increase your risk of infection. Unfortunately, we have a lot of MRSA, which is resistant staph, and taking antibiotics has actually been shown to kill everything except MRSA, and we actually select for it and actually increase our risk of infection. Some preoperative things we ask people to do: cleanse with something called Hibiclens or chlorhexidine. Although you'll vaguely smell like a hospital operating room, it tends to decontaminate skin from, you know, things like MRSA, Pseudomonas, and other things that we worry about that can cause bad skin infections. Finally, we tell patients, don't smoke, drink lots of water. I mean, do the things that make your body healthy. Healthy body equals healthy tissues equal good healing. So these are some things that we just want to make sure patients are mindful of. Later on down the line, silicone gels, maybe injections of steroids to decrease risk of hypertrophic scarring or keloiding. Those are all things that we take care of because I make sure that I follow all my patients through several post-op visits to make sure everybody is on the proper track for healing. So with the combination of good technique during surgery, good incision selection, good post-op care by the patient, and good vigilant follow-up by the surgeon after the fact, we can ensure that scars are at a bare minimum and essentially invisible.